Welcome to the Healthcare Revolution podcast, where we empower you to take control of your life, restore trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, Doctor of Physical Therapy. I am the owner of an award-winning physical therapy clinic here in the Salt Lake Valley. Each episode, we dive into all things rehab, injury prevention, overall health, bringing you expert insights from leaders across various healthcare fields. Please note, while we aim to provide you with the best knowledge and advice, the opinions shared on this podcast represent those of the experts. They don't replace professional medical advice. So let's revolutionize healthcare together. Today I have with me Sydney Friesen, who is a doctor of physical therapy and has advanced certifications in vestibular rehab, which is also known as dizziness rehab. So Sydney, welcome to the podcast. It's good to have you on.
Thank you.
Just broadly, generally, what is a vestibular therapist?
So a vestibular therapist is someone who has specialty training in treating balance and dizziness. So we help people improve their stability and then overcome the dizziness that impacts their life.
Who are the people that you mainly treat?
There is quite a wide range. It can range from young individuals to older adults. I feel like it could be pretty much anybody in the population, really.
Tell me the young populations that you see for like the moms that, their son comes up and says, I'm dizzy. Tell me those cases.
Yeah. A lot of times kids don't just develop dizziness, but it is definitely possible. Kids can develop migraines, which can then come along with dizziness. So that's something vestibular therapy can help with. We also play a big role in helping treat concussions. Concussions can create a lot of dizziness and headaches and neck pain in individuals. So that's pretty common among young athletes. And then there's been some emerging incidences of vestibular migraines in women, mainly kind of in the menopausal age range. So this tends to kind of be people who had migraines when they were younger. A lot of times those migraines even went away for a long time. And then just with hormone changes or just life changes, they kind of came back, but they came back different as more of a vestibular migraine.
Yeah.
So those are two big populations right now.
Awesome. Tell me about the older adult. What are the cases that you see with the older adults that just have recurring or chronic dizziness?
Yeah. So as we age, it's completely normal for your vestibular system, which is your inner ear system that controls your balance and it helps communicate to your brain where you are in space. It's normal for that system to kind of start to function less as we age. And this can just be a result of normal aging. It can happen because we become more sedentary as we age. So that system's not getting the stimulus it needs to stay strong.
So you're telling me we can get dizziness just from not exercising or not moving as much?
It's actually super common for people who've been hospitalized and bedridden for a really long time to develop dizziness. And it's just like strengthening a muscle. If you don't strengthen that muscle, it starts to atrophy and get weak. Same thing happens to your inner ear. If you're bedridden or just very sedentary, that inner ear starts to get weak, and then you can develop dizziness as a result.
Often we talk about in the PT world, the three different balance systems. Tell me about those three balance systems.
Yeah. So the one we've already mentioned is that vestibular system. I would argue it's probably the most important system. It's basically your inner ear gyroscope. So it tells your brain about what position you're in. It communicates information such as the movement of your head, what direction your head moved, how fast it moved.
So I just move my head to the side, it detects that movement.
Exactly, yeah. And then it also detects gravity. So it has little sensors in there that literally detect gravity and let you know, are you moving up and down, like in an elevator?
Nice.
Or are you walking, running? Are you on a treadmill? Those types of things. Your next balance system is your eyes. So you might notice you maybe feel a little bit more off balance in the dark. If you close your eyes and stand on one leg, it's a lot harder than standing on one leg with your eyes open.
Yeah.
And then that final balance system is your proprioception, which is the nerves in your feet and ankle that communicate to your brain about what position your body's in.
Yeah.
So these three systems work together to tell your brain about where you are. And ideally, we would want 2 out of 3 functioning, if not 3 out of 3. So when you start to have only 2 out of 3 working, that's when we start to have issues. And if you only have one of those systems working really well, then you're going to really struggle with your balance.
Yeah, for sure. Tell me all the different types of vestibular disorders that you see in the clinic, ones that you refer out to maybe an ENT and a ear, nose, and throat doctor, and then the ones that you treat on a regular basis.
Yeah, so one of the most common causes of dizziness that we treat quite often is called BPPV. So a lot of people have just heard of the ear crystals. So the ear crystals are those little motion sensors that detect gravity.
What do you call those anatomically
They're
speaking?
called otoconia.
Okay.
And they're just little calcium deposits. They have some weight to them, and they detect gravity and communicate to your brain kind of where you are against gravity. They can become dislodged and fall into a canal. You have 3 fluid-filled canals in each ear, and these canals are responsible for detecting things like acceleration and deceleration, not gravity. So when that little otoconia falls into a canal, it changes how those canals work and creates that room spinning vertigo that people will get when they roll over in bed, sit up out of
Typically,
bed.
how long does that last? Say someone's trying to differentiate what types of dizziness they have. How long does that last and they roll over in bed?
Usually it's super brief, sometimes as short as 5 seconds. Kind of max is typically 30 seconds. It can be up to a minute though. And it occurs with very specific positions. So a lot of people can identify it happens every time I roll to the left. I'm fine all other times, but I get dizzy when I roll to the
What does the BPV
left.
stand for?
Benign paroxysmal positional vertigo.
Yeah, so it's very positional, right? So you
exactly.
switch positions, and that's when the dizziness comes on. But less than 60 seconds is what we look for.
Typically, yes.
Yeah.
And when this happens, I do kind of like to tell people that this is the vertigo you want if you're going to have vertigo, because it's something that we can treat pretty quickly and easily in just a few treatment sessions. The average is like 3 to 5, because we just do repositioning maneuvers to move that otoconia out of the canal and back to its home. It's kind of like those little maze toys with the ball and you tilt it. Try and get the little ball to its home.
That is a good explanation. I've never heard that one before. We used to treat BPPV in the hospital, in the emergency room, and doctors just think you're a magician when you solve this problem. And patients are like, oh my gosh, I thought I was dying.
Yeah, it's super scary. A lot of people end up going to the emergency room thinking they're having a stroke.
Yeah. But PTs are the people to reposition those.
Exactly. Yeah.
Tell me about the other just vestibular cases that you see.
Yeah. The other most common cause of dizziness and vertigo that we're encountering is vestibular migraines. And this is something that's kind of really confusing people, because when you hear migraine, you think head pain. And we're actually finding that you don't have to have a headache at all with a vestibular migraine. Think of all of the other migraine symptoms, such as noise sensitivity or light sensitivity. But instead of headaches, you get dizziness. You can get a headache with it as well. It's just less common. A lot of people, like I kind of mentioned earlier, are developing these later in life, pretty typical in women as they're going through menopause. A lot of them had migraines or even motion sickness earlier when they were in childhood, and then they kind of went away for a while, and then they came back later. Vestibular migraines, you tend to have episodes of vertigo or dizziness, which are 2 kind of different things. And then that can last 24 hours, maybe a little bit longer. And then depending on the person, sometimes you recover between episodes and you feel better, and sometimes you don't, and you'll get lingering dizziness.
There's a little inconsistency there.
Yeah. And what can be confusing about vestibular migraines is you can also get positional dizziness. So it can kind of mimic BPPV. So a lot of people are being misdiagnosed right now because they'll see positional dizziness and hear positional dizziness and think they need the BPPV treatment, but they don't.
Yeah, I love it. Tell me about, like, what are the goals of physical therapy with these different types of dizziness? How do you know when someone's progressing?
Yeah. So a lot of the goals are improving how a person can manage their dizziness. So one of my first priorities is to just teach strategies to help you manage it. Vestibular therapy is not a quick process. Usually it takes time for it to start to recover, and there's a lot of ups and downs on that road to recovery.
So it's not like your typical musculoskeletal pain, ankle sprain, where you just have this linear progression. It's kind of a up and down, but you're eventually linearly going up.
With the hope that you're going up linearly, but there's going to be ups and downs along the way.
Yeah.
What I like to tell people is as soon as you think your dizziness is gone and you think you're good, it's going to come back. It always does. And it's not a sign that you've regressed. It's just kind of how that rehab process goes.
Great. How quickly do you see someone respond with BPPV?
BPPV is the exception to the rule, where sometimes people have an immediate response with just 1 or 2 treatment maneuvers. Sometimes it takes a little bit longer. The average is about 3 to 5 sessions. So that's the exception to the rule. Most other kinds of dizziness take a few weeks to progress.
And then tell me about the ones that you see the most, where you're, in the physical therapy world, we use habituation. Define habituation for us, and then talk to us about About how long does it take someone to actually get through that in rehab?
Yeah. So we have, in the vestibular world, we have some kind of clumps of treatment. Habituation is one of them. And habituation is basically doing the things that make you dizzy. So I always like
That's
to
not very
warn
fun.
people of that ahead of time. But it's doing the things that make you dizzy with the goal of creating neuroplasticity. So that's the ability of your brain to reinterpret the signals from the inner ear so that it can relearn that those movements are okay.
Love it.
So what happens when you're dizzy is
So these are your sedentary people, right? That have been sitting.
this could be anybody, because when you're dizzy, you're going to stop moving your head without even realizing
just
it.
moving
Yeah, you're
around
going to
like this,
move
right?
as a unit. You're going to turn your trunk instead of your head. And a lot of people don't even notice that they do it. And as you stop moving your head, you become even more sensitive to head movement because your brain is just super confused. It doesn't have good signals. So with habituation training, we do super gentle introduction to the things that make you dizzy. We keep it super manageable. It's going to increase your dizziness a little bit, but then we take a break.
Nauseous and throwing up in the clinic.
None of that. None of that. Manageable increase in dizziness, and then we take a break and we let it calm down.
That doesn't sound like a therapy I want to go to. But I mean, it's all about getting it better, right? If someone's been dealing with this for 6 months, I can't imagine how frustrating that would be.
Yeah, dizziness is incredibly debilitating. It creates a lot of social isolation because people feel they have the appearance that they're drunk, so they're afraid to go out in public. They're afraid to interact with their friends.
Which then creates this vicious cycle of more dizziness, right? Because then they're not moving, they're becoming more sensitive, and they just can't function anymore.
Yeah, and then we also have something called the dizzy, anxious, dizzy cycle. Dizziness and stress and anxiety are kind of interpreted together in your brain and processed together. And we have a term for it, the dizzy, anxious, dizzy cycle, meaning you get dizzy, so you become more anxious. And dizziness creates a lot of fear. You don't really know why it's happening. You're afraid of falling. And then that anxiety leads to even more dizziness. So a lot of the goal is trying to calm down both of those systems, because if we just tackle the dizziness but leave the anxiety alone, it's not going to be as effective as treating both things together.
Yeah. Let's give some advice to the patient. The patient that maybe it's their loved one that has dizziness, maybe it's them that has dizziness. What advice would you give someone? Google is so easy. We can look stuff up really quick, but what advice would you give someone with dizziness? Just general.
Know that it can get better. The majority of people with dizziness have gone through a very long process of getting a diagnosis and getting to the right person to treat it. Most people feel very hopeless by the time they find the right person, and they think it's never going to improve. So unfortunately, our medical system is kind of lacking in that sense, as we should be doing a better job at diagnosing these people and getting them to the experts who can help them. And that's something that we're still working on along the way.
Yeah, not too many people know that physical therapists are experts in dizziness. It's movement related, right? That's our jam.
And we play a huge role also in helping patients determine, is PT the right place for them? Do they need to see an ENT? Should we do further testing? Is it something concerning, like a brain tumor? Or is it something that probably isn't too concerning, like you had an inner ear infection that caused the dizziness?
Would you argue that PTs should be the primary care for dizziness?
I would, yeah. And there's
or at least one of them.
Yeah, there's a lot of emerging changes in the healthcare field where there is a PT in the emergency room who will go and screen patients with dizziness. That
was me when I worked at St. Mark's. That was part of my role, is to get in there and see if it was something they needed to manage with medication, see if it was blood pressure related, see if it was movement related, and then essentially correct the problem and get them out.
Yeah, and we're very trained and skilled in screening it and knowing where to send people if PT is not the right place for them.
I love that. What would you like to see happen in our medical system on top of that?
I would just like to see more providers who treat a lot of patients start to understand better what dizziness is. I have had a lot of people come in too with just a generic BPPV diagnosis, because people they hear dizzy and they're like, oh, it's the ear crystals. And then they don't really know how to manage it. So they'll tell a patient to look up an Epley maneuver on YouTube. The patient does it for 5 weeks and it either doesn't get better or it gets worse.
What's the issue with YouTubing the Epley's maneuver?
Yeah,
or other maneuvers. How many different maneuvers are there?
So many different maneuvers. Can't even count them.
What happens if you get the wrong one?
Depends. So you have 3 canals in each ear. those ear crystals can fall into any of the canals. So it's really important to see a specialist because we can identify what side it is it the left or right ear, and then what canal it is.
Yeah.
And it's a different maneuver depending on what side and what canal.
So you picked the wrong one on YouTube.
You
it
could
essentially
make it
can make it
worse.
worse.
Yeah.
Yeah. So it doesn't mean that the epilume or maneuver didn't work. It just means you got the wrong one.
Yeah.
And that's the purpose of providers, to help you identify the right canal, apply the appropriate treatment, and then get you back to the things that you need
Exactly.
to do.
Yeah. I pretty much never have patients do it on their own because it's also important to get the exact correct head position. If you're off by 10 degrees of head rotation, it might not work.
Yeah.
So I almost never have patients do it on their own. I always just
I
make
hope
sure they remember who I am, and I'm like, come back to me if it comes back.
I hope our primary care docs on the show that are listening to this can hear that, because it's so easy to just say, I have docs reach out to me all the time that are like, hey, can you get me a list of exercises for people with low back pain? And I always just take a deep breath and I usually say, can I borrow your glasses? And they work for me. Everyone's so customized. Every back pain is different. I could give one exercise to one patient and it's wrong for them and it makes them worse. And I could give that same exercise for the next person, but it's customized to what they need and it's adapted, right? And same thing with vestibular. You can't just say, go YouTube it, or here's a handout, right? There's so many intricacies that need to be adjusted, and it only takes 3 or 4 sessions with a PT most of the time,
Right.
Yeah. And then you get it done right,
Mm-hmm. And vestibular is even more important to be so customized because we want to just really target the things that are making you dizzy.
Yeah.
A lot of people will get kind of just generic blanket vestibular treatment, and it helps a little bit, but it's not quite enough.
Yeah.
And that generic treatment might be okay at the beginning, but then in order to really get people to that next step, it just has to be customized to what they're struggling with because it's so different with everybody. There's 3 canals in each ear. There's 2 areas of each ear that detect gravity. Depending on what the condition is, it might be these canals are affected, but for someone else, it's those canals.
Yeah.
And it all just changes. Some people, horizontal head motion makes them dizzy. Some people, it's vertical. And you just really need to figure out all those intricacies.
Yeah, I love it. Any last advice for either patients or providers on improving trust within our system?
I think just don't forget that there are people that treat dizziness, and just try and find the right person. And we will help you navigate the system. Once you find that right person, we will help you figure out where to go. Even if PT isn't the right fit, we will help you figure out who you need to see.
I love that. And you do it every day. Thank you, Sydney, for joining us today. We appreciate you being on the show.
Yeah, thanks for having me.